material to, and we are trained to perform large scales of spill. So small spill is anything below 20 cc, which is like about this big. And again, if there's like something that you are not very comfortable, if these liquids somehow get into some really hard to reach area, you probably would like to. You should actually contain the area and contact safety, and we will be able to perform the cleaning. So, in order to perform the cleaning, you need to make sure you have one of these spill kits available. I spoke to Yesenia. Yesenia will be able to obtain a few in the office. So you want to make sure like where to find them. Talk to Yesenia to see where to find them. But if you don't find it, the other location where you can get them is from Central Issues. You can get them in Central Issues. If the spill occurs in 4 Southwest or maybe in, actually not 4 Southwest, most likely non-infusion center or short infusion center, very likely they have this kit already available because they handle like a large volume of infusion in that location. They do have a kit very readily available in those locations. But if you ever need to get extra one, Central Issues have one, and Yesenia will go to find a few more. Okay?
Should I spill it? You know?
Go ahead.
Also, another definition of big and small. Okay, so a small spill, you all can clean up, maybe nursing can clean up. And a small spill, another definition, you can clean up a small spill because you've been trained and or you know how. You have the proper personal protective equipment to protect yourself. You have the proper materials to use to clean it up, and you feel comfortable doing so. That's a small spill. If any one of those 4 elements don't exist or are missing, that small spill becomes a large spill, and you can call EH&S. So it may be a small spill in volume, but let's say it's gotten into a mattress, for example. Got into a mattress, or it's spilled onto a phone or medical equipment, and you think, how are you going to clean that out? That falls in a category you may not be comfortable cleaning up, but then it's a large spill and you can contact us. So this little demonstration may seem cheesy, but we have to do it. Oh no!
Wow.
From IV bowl. Patient unplugged the IV and spilled on the floor, and you get called. So you need to get a chemo kit, complete one, to make sure preferred it's never been opened. So make sure you down up.
And this is where you can really take your time, make sure you're doing the right plan, what you're going to do.
It will be best if you also have an assistant with you so that don't do it all by yourself, because you might not want to be the person who go back and forth. It will be nice to have someone outside the room to assist you passing any items if you need it. There's always like a buddy program we always try to talk about. Oh, you want to help me?
I'll be your buddy.
Yeah, that's helping me because this is kind of hard to consider. That's not it.
You may be in cleaning it up, but you may need more paper towels or something. You can call out to your partner to go clean up.
One thing I also want to say, during a spill, if this is off hour, do ask the nurse of the medication, what kind of drug being spilled. Just write it down so that we can keep track of what it is. And,
Yeah, that's something we do when we clean up spills with varying degrees of success, but we're pushing more and more that a nurse, a pharmacist, someone in the area stay there while we clean up the spill, because they're the ones who are knowledgeable and can also help out. Sometimes you get a little resistance, they want to just, okay, we spilled it, you clean it up, but we do try to keep somebody from that area on site.
yeah, you don't want people walking back and forth, stepping onto it. You want to remind people not to step into the area.
Yo voy a aparecer chorizo con ese puesto.
And that is the first step, what Kitty was saying, is to make sure nobody goes into the area. Secure that room. Somehow you may have to go do something real quick, come back, and maybe someone has stepped in and tracked it throughout. So securing the area is the first step. A lot of these chemotherapeutic agents, they're liquid. You know, they're going in IV, they're going to the patient. They're liquid. liquid, but they also quickly dry. So even within 5 minutes after spill, you can see that it's dried, but you usually see the residue, a dry white powder or something in the area where the spill was. When you do that, you a lot of times need extra water to rehydrate it so you can clean it up easier. And it is all water soluble, so you can add water, and it does dissolve up into the water easily.
Just water, right? Just water?
What's that?
Just
water. Copious amounts of water.
You don't want to add alcohol, you don't want to add any reagent because you might end up, you don't want to spray Virex in it because you never know if the chemo has to react with it, so that we are putting water if possible. So double glove, one glove inside the cup.
And I'm guessing maybe 50-50. 50% of the time, it's something neat like that. Another 50, it's in a mattress, it's in the nooks and crannies of the bed. It's on an IV pole, a drip into the IV pole, or on a phone. We've thrown away IV poles, we've thrown away phones, because it gets in there and there's no way to really clean it. And you know, it's in the phone, it's not going to go anywhere until somebody opens up the phone. So you do take that stuff and kind of dispose of some expensive stuff that way.
Where do we throw the phone or the IV pole?
What's that?
Where would you throw the phone or the IV pole? Just in the regular trash?
No, you can secure it, meaning wrap it up in plastic, put a label on it, put it somewhere secure from anybody else, then call us, Environmental Health and Safety, and then we'll come get it. Actually, it has to go out as hazardous waste.
One inside the cup, one outside the cup, double glove. In the kit, when you open it, you also, once you see the liquid, you will see something printed as Chemo with the word on it. Use this particular thing because this one is a special absorbent that could kind of solidify the liquid. So you kind of want to let it.
And it's a special, it's absorbent, so it absorbs a lot, but also then does not allow drips or anything when you're manipulating it after the liquid's absorbed in there.
So you let it put it on top of the spill area. I probably can't do it. So pretend you're outside. So after you get you absorb them, in the kit you also have some kind of like a duster kind of thing, scooper. Say if it's fully absorbed, you might want to use the scooper. Don't use your bare hand because you want to reduce contamination as possible. Try to scoop it in and then put it in the yellow bag. Say if there's like some residual, what you should do, you can get one of these excessive paper towel, get some more water, just kind of wipe it more if needed. So it's just like, if you still see a little bit of residual, get some more paper, get some more water to wipe it down. And then, if everything looks good, leave the soap into the yellow bag. And then, what we can do, we just, after we perform all the cleanup, we dispose all the contaminated items into this yellow bag. I take out the other glove, and then I pick up my down. Bottle and my evaporator into this. I'll get this back, and then I'll get another bag. Put it into the second bag. Then the inner glove dispose of this yellow bag, and then we hide it. Say this is already tied, but I just want to say if you already tied it, the whole element will go into a cytotoxic container, the yellow container. If it happens to be a long infusion or a short infusion room, you will already see one, or one of the nurse manager could assist you to get a new one. If you see an empty one, just stick the whole thing into the chemo waste container. And after you finish that procedure, you can actually resume the EVS normal cleaning procedure after you put everything into the chemo waste container. Any question?
Yes.
Okay.
If there's a spill like on a floor, is there a certain amount of time we have to mop the floor, or
You mean mopping in the sense that after
after
you
it's
finish?
cleaned up? Yeah.
No, but I would suggest most of the time, for example, in the infusion room, this is a very heavily used area. They would ask EVS to clean it as soon as possible so that they could let the patient go back to continue the infusion. Normally, they will ask you pretty fast to do it right away because they need the room.
Because it happened in 4 South the other night, maybe Sunday night, and the charge nurse up there asked us to mop it 3 times. Basically, just clean it up. I don't know if that was like protocol or.
How many times?
3.
Wow.
Yeah.
No, just after you clean up like that?
You have to first clean
That's
up.
good
You
mop.
don't-
Just a good mop? Okay.
Yeah.
I remember 10.
Thank you.
3, 2.
Because at the second time after we use the chemo swab, we already have use a lot of water and paper to wipe down the area really well, so that in addition to your normal cleaning, it's actually doing a really good job to remove any residue that will be on the floor. And again, if this is like a very large scale, it will be a different story. Then maybe the office will be involved and do a little bit more of the cleaning.
I have another question for clarification. You indicated that bag will go into a chemo waste container.
Yes.
And I know that we recently learned in the pharmacy, there's a trace and non-trace.
Good question.
So would that go more appropriately in a trace container?
Good question. Yes. If you go to the only place you will see non-trace chemo waste is in pharmacy. Pharmacy is the area that will handle all the unused medications. Say if a patient did not finish the chemo, the drug will go to pharmacy. This is the only place you will ever see non-trace pharmaceutical waste. All other locations in our cancer center, in the infusion center, for Southwest, you will only see trace chemo waste. Because the non-trace chemo waste, just for you to understand, will be picked up by safety office. EVS will not, even though they both yellow container, safety office pick up the non-trace chemo waste. So the trace chemo waste are normally picked up by EVS because they're handled by 2 different companies.
And we were chatting some of the unconventional ones, talking beforehand how we could get some mattress or a fabric. We can't, really clean that out. A few little drops, you need a lot of water and get out that way, but if it's really saturated to a mattress, then actually that whole thing becomes hazardous waste. There's no real good way that we can clean it.